Well, I've been at ICHOM for 2 years now, and there's been enormous change in the conversation about value-based healthcare. It used to be thought of as just a theory, and now I think we can honestly say that we see it in practice all around the globe. And we see this in the conversation about patient centricity. We see businesses and payers coming to the table and being more curious about what patient inputs actually should be in healthcare. And we see continuing clinical leadership in implementing value for health. Well, you know, for 2 years I've had the privilege of watching the actual impact of ICHOM, and it's truly global. Every day I see examples of value-based healthcare in action and the impact that it has not only on the clinical practice and on the bottom line for health systems, but most importantly for the patients. We're really seeing that value-based healthcare, when we focus on the outcomes that matter to patients, it has an impact that benefits everyone, but most importantly the patient. I have to say I'm most proud of our patient engagement and how it's expanded since I joined ICHOM, both with adding a patient to our board of directors, as well as starting the Patient Partner Alliance, which really is a relationship building initiative in which we are looking to create a long-term partnership with patients to help them understand how beneficial health outcomes measurement can be to their advocacy for themselves and for their communities, but also that we learn from them about what's most important and what we need to be measuring in the healthcare system. ICHOM plays many roles in advancing value-based healthcare around the world. I mean, first and foremost, it's our patient-centered outcome measure sets. That's the core in which we bring international consensus with patients to identify what are those domains and outcomes that are most important to them that we should be making the center line of care delivery. And then we also provide impact. We show the impact through our case studies, through webinars. We host ICHOM Education, which is about building core competencies and the skills that are necessary for the next generation of leaders to really implement value-based healthcare. And then we cap it all off with our accreditation program to really tell healthcare entities, health systems, how they're doing on the journey of implementing patient-centered outcome measurement. I spend a lot of time thinking about what ICHOM's future is, and I think that the biggest role that we can play is to continue to lean into the implementation and demonstrating the impact of value-based healthcare. There is no other organization in the world that's really taking a global look at this and not only monitoring what's happening through our implementation directory, but most importantly, showcasing what does good look like. So I think that's going to become even more important in the future because there's so much interest and leaning into this notion that we have to do something completely different in healthcare. But ICHOM is unique in that we have been the keeper of the flame, if you will, of what does standardized outcome measurement do, how does it work, and how can it be the bedrock of true change in the healthcare delivery system. So I think our primary focus ought to be, what does good implementation look like? How do we activate that? What kind of leadership? What kind of resources do we need to invest? And most importantly, what are the proof points that tell us that we're actually moving the needle and creating more health for patients? You know, the ICHOM conference is one of my most favorite events of the year. This is my third ICHOM conference, and I always get so energized by being with the people, the community of practice that ICHOM brings together every year. We have over 600 people coming from 44 countries, I believe, and it really speaks to the global community that ICHOM represents. I'm most looking forward to hearing from some of the leaders in the field about how they are looking back and seeing where their lessons learned have really played out to be successful in system-level reform. And I'm also really looking forward to hearing from our patient communities. They always challenge us to think in different ways, to think forward about how to involve them in system redesign, what we should be measuring. So it's a vital part of our community to hear from them and to take our marching orders, if you will, for what we need to invest in the future. And I think, both of those things are aspects of the ICHOM conference that I think are truly unique and make us not just a conference, but an actual laboratory for action. And so I'm really looking forward to immersing myself for the next 2 days and not just leading this organization, but learning from it.